Hello, my name is Amber Horton, and today I'll be performing a comprehensive diabetic foot exam. One of the first things you need to clarify with your patients are, have they ever had a diabetic foot exam before? And if they had, when was their last one? You will need to review their past medical history if anything has changed since the last time they've been in to see you. Review all medications the patient's currently taking, any complications they may be experiencing with their feet. Pain, numbness, or tingling, decreased sensation, edema, any changes that they've already noticed at home, as well as their fasting blood glucose levels, or how well controlled is their diabetes, what was their last hemoglobin A1C. Go ahead and ask the patient if they've had any recent deformities with their feet, whether if they've had a recent break or sprain or any other problems, any stiffness or weakness they've had in their legs or lower extremities, any rashness or itching, nail changes, any scaling or dryness that they've had, as well as any if they've had cramps, notice change in colors of the skin, any other complications that they could have with their diabetes. You're going to go ahead and inspect both feet and both legs for any temperature or color changes, any visual things that you can already see that's with the patient. We're going to go ahead and start with his left foot. You're going to inspect the skin, the color of the skin, the warmth, temperature, make sure that it's not too warm in areas. There's no bright redness that would be a risk that's already a formed infection. The hair distribution, is there any areas that have already begin to have changes that the patient may not have realized? You're going to look at the skin for any dryness, scaliness, any areas that would be of concern, any possible wounds that they may already have, that they might not even be aware that they do. You're going to look for hammer toes, calluses, corns, any athlete's foot, or possible nail fungus that they might have. Inspect the toenails as well. Make sure that they're cutting their toenails straight across if it's a patient that doesn't have any known complications with their diabetes at the time. If they already do, make sure you recommend that they come in and let you take care of those nail clippings for them so that it doesn't become a problem between their with their toenails. You're also going to go ahead and check the pulses. We're going to check the top of the pulse, the dorsalis pedis, as well as the posterior tibial. He has good strong pulses. We're also going to check the capillary refill, and this is something that you can teach your patients, that they can actually check their capillary refill as well of their toes to know that their circulation is intact. We're also going to check the strength of the foot. Push down on my hand like you're pushing a gas pedal. Good. Now pull your toes up. And this is something that you want to check to make sure that they have good strength in their feet, because if not, they're putting too much pressure on the top of their feet or on their heels. If they're rocking their foot forward, it would be something you'd be concerned about developing an ulcer on the tips of their toes. If there was a change within the circulation as well, if you notice that pulses might not be quite as strong as one foot to the other, you could do a ankle brachial reflexive index test to know that if there is a for sure change, and if we need to do some more studies to find out exactly how this is. You're going to check the protective sensation that the foot has. Use the monofilament. You're going to have the patient close their eyes and tell them if they can feel what you're doing.
Yeah. 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 Yeah.
And this is also very good to remember, to make sure that you document where you checked on the foot if you do not check all the areas the same times, just so that you know that you are checking it consistently and you know when a sensation has changed. And this is also something that the patient could check at home. You're going to check the vibration sensation. Have the patient tell you when they no longer feel the vibration.
Yeah.
Okay. And I can no longer feel it with my hand as well. These are something that you're going to be concerned about if the patient does not have that ability to feel the vibration, as well as the sensation changes if they are developing neuropathy. You're also going to do a sharp and dull test. You're going to show the patient this is something dull, as well as this is something sharp. Okay, and close your eyes and tell me what you feel.
Dull. Sharp.
Okay. Those sensations are intact as well. You're also going to check the reflexes. Check their ankle reflex. And then you're also going to check the reflexes at the knee as well. And any changes in that you need to be concerned about is the same thing as well. Is the patient developing neuropathy, as well as the vasculopathy? There's different things that this is why we perform this test. This is why this is so important, so that we're taking care of any preventative things that we could complications from his diabetes. As well as determine if their shoes fit properly. We're going to have him put back on his shoes, make sure that he's wearing a good protective shoe that's appropriate. And also remind him never to walk barefooted. Always have shoes on, whether he's inside or out. Preferably not something and to check the inside of their shoes to make sure that there's not something inside it before they put that shoe on. Teaching this patient to check his feet daily. Make sure that there's no wounds or anything that's already formed, any change in sensation that they can feel. Even making sure that they understand to check the bathwater with their hand, never with their foot, for the risk that if they do develop this change in sensation, they may not realize it until it's already too late. It's also important for them not to treat calluses or corns at home. It's something that if they have, they need to come into the clinic and let us look at it, as well as ingrown toenails. That's something that they don't need to treat at home. Go ahead and come in and we can look at it so we're not developing any type of infection. If the patient has no signs of neuropathy, he can follow back up in a year. Any changes that he notices, of course, we would advise him to come back in sooner. If they do have a risk of neuropathy, they do have a change in one of their sensations, we would have them come back in 6 months just to reevaluate that. But if they do have a change in their sensation, risk of neuropathy, or have any vascular or circulation problems or known deformities, we would have them come in more often on a quarterly 3-month basis. And of course, if they've ever had a previous ulcer or they've already had an amputation, then we're going to have them come in every 2 months to make sure that we're not having further complications and would need a possible further amputation. Do you have any questions for me today?
No.
All right, I think that pretty much concludes our foot exam. Thank you.